guys, my name is Vishali, PAS, and I promise you that I'm not that scary. I will be talking about and performing the simple interrupted suturing technique. I first want to go over some of the indications. Simple suturing is the most common technique and is for shallow wounds without any edge tension. Interrupted sutures are individually placed and tied and is used if the wound is likely to become infected. This way you can remove a few sutures without disrupting the entire closure. There are many contraindications to suturing. Some of these include redness and edema of the wound margins, any type of puncture wounds, presence of foreign body, tendon and nerve involvement, contamination, injury to underlying structures, and any wound greater than 12 hours old on the body. There can be many complications that arise from suturing, such as scarring, extensive tension on the suture, reaction to the sutures, and patient discomfort. After wound evaluation and irrigation, you'll need the following for suture placement: latex gloves, a needle driver, Addison's forceps, suture scissors, and appropriate suture material. Position the patient with the laceration fully exposed and well lit. Apply a sterile fenestrated drape over the wound. You want to start in the middle of the laceration in order to avoid dog ears once the suturing is complete. Pull the thread all the way on the first bite before inserting the needle on the opposite edge of the wound. Make sure the bite width and bite depth are the same on each side. Wrap the thread around the needle driver twice in order to secure the first knot. A single loop on the next 3 throws will suffice. Grasp the end of the suture with the driver and pull the 2 lines across the wound in opposite direction. The remaining sutures are inserted in the same manner. Grasp the skin with the Addison's forceps and insert the needle at 90 degrees. When the needle passes through the subcutaneous tissue, unclasp the driver and grab the needle with the forceps and pull the thread through. For most areas of the body, sutures should be placed in the skin 3 to 4 millimeters from the wound edge and 5 to 10 millimeters apart. It is also important to evert the skin edges so the underlying dermis from both sides of the wound are touching. This allows for optimal and proper wound healing. Another point is to avoid strangulation with the suture at the superficial skin level and place knots away from the wound edge. You want to take care to avoid tension during closure. Let's review again. Start on the side of the wound opposite and furthest from you to ensure you are always sewing towards yourself. This allows a more smooth process. Once you enter the needle at 90 degrees, 3 to 4 millimeters from the wound edge, you want to rotate your wrist to follow the arc of the needle. The principle here is to minimize trauma to the skin and prevent the needle from bending. Don't forget to pull the thread in opposite directions in order to secure the knot. Another tip is to grasp the needle at its midpoint with the needle driver. This prevents the needle from bending. Remember to never handle the needle with your fingers. With any type of wound, it is important to preserve the tissue and its function, minimize bacterial contamination, remove foreign bodies, achieve hemostasis, and handle tissues gently. Once you complete the procedure, clean the area and make sure all sharps are disposed in the sharps container before leaving the bedside. Next, you want to explain the follow-up procedures to the patient. Educate the patient on signs of infection, dressing changes, wound checks, suture removal, bathing, and address any further questions. And that's a wrap, you guys.
Action.
Thank you for teaching me.
You're welcome.